Happy World Malaria Day to everyone watching this video. So today I want to remind you that malaria is one of the leading causes of death globally every year globally. So if you feel like you're an African and then malaria is one of those diseases that you feel like, yeah, you can just take anything and then you let it slide. Malaria can kill you. So before you treat malaria, make sure you run a quantitative test. Run a quantitative test. Quantitative test, we have qualitative and quantitative. Qualitative is in the sense that it will just show you that malaria is there, but it will not show you the amount of the parasite in your blood. Quantitative will show you the exact amount of the parasite in your blood, and that will give your doctor a good guidelines on the medication to place you or the treatment to place you. So before you treat anything, like if you're having symptoms of malaria, make sure you run the test before you treat. You can't be treating malaria with a higher drug, meanwhile you are having a 1+ of malaria. So make sure you run a test, a malaria test, quantitative test, before you take malaria medication. Some of you will just, if you start feeling headache, you start feeling somehow in your body, you just run to pharmacy and start taking medication. No, it doesn't work like that. It doesn't work like that. Make sure you run a test before you treat malaria. Run a test first, so you know the amount of the parasite in your blood. Secondly, whenever you're treating malaria, avoid anything that has to do with vitamin C. Avoid it, because it's more like a work done. I think I've made a video about this. It's more like work done equal to 0. If you are treating malaria and you are taking vitamin C, the vitamin C will be stopping the malaria. It will inhibit the drug from doing the work it's supposed to do in your blood. You are just doing work done equal to 0. That treatment is not going to be effective. So if you are taking malaria medication, avoid anything that contains vitamin C. Thirdly, if you are treating malaria, make sure you finish your drug. If doctor says you should take it for 7 days, finish it for 7 days. If doctor says you should take for 3 days, finish those drugs. Some of you, if you start taking medication today and you feel better tomorrow, you stop medication. No, you are abusing that medication. Finish it. Finish that medication. Even if you feel all right, finish those dosages. And lastly, how can you prevent malaria infection? Number 1, make sure your environment is clean. Your environment is very clean, both inside and outside your room, your house. Make sure that environment is clean. Your toilets should be clean as always as possible. Number 2, use treated mosquito nets. Yeah, use treated mosquito nets. Use treated mosquito nets. And then number 3, make sure you cover yourself properly whenever you want to sleep. So if you're having any symptoms or signs of malaria infection, kindly go to the hospital so you can be taken care of properly. Happy World Malaria Day to all of you out there. Stay safe. Kindly follow us.